I think Dr. Smita has already introduced actually the topic. So what I'll do is I'll just introduce the technology because we are talking a lot about UBM in this. So I'll just give you a little bit of recapitulation about the technology, what the UBM basically is. So this helps us require and view real-time high-resolution images of the anterior segment under magnification, and that allows us to determine the relationship between different ocular structure in the anterior segment, especially related to the angle. And this is a non-invasive imaging modality and produces high quality images, two-dimensional of course, but I think that's clinically is very useful. Typically you have about 50 megahertz frequency probe, but it could be higher or lower. More often we are getting 30 megahertz these days, but I think for good resolution you have to have 50 megahertz probe, and which gives you a about the later resolution about 50 microns and the axial about 25 microns. But as you go higher in frequency, the tissue penetration gets less. So that's a kind of trade-off. The principle is simple, is like any other ultrasound, is basically a pulse ecosystem. So you send some echo pulses at certain frequency into the tissue, and the echoes which are returning, you just capture them, and because they're timed. So from the the time of the sending to receiving, that gives you the distance or location of the or the object which is sending reflecting the sounds, and also how much sound received, that gives the intensity. So basically two parameters, the time and the intensity, and then you have those multiple echoes coming back, and then you reconstruct it two-dimensional image because they're like a B scan. So the principle remains the same. So to get a lot of echoes, this is oscillating kind of a transducer, so that you can cover a certain area or certain angle in the tissue. The important thing is that you need to have a very good tissue probe interface, and because if that's not taken care, then a lot of sound will get reflected off the interface itself, and then the image quality will be poor. So when you're doing an ultrasound, for UBM you will invariably need a water bath technique, where so that the reflections from the interface are minimized. And as the sound wave travels to tissue depth, you can create these images, and changes in the tissue density interface and the interface are shown in various degrees of brightness. So this is how you reconstruct that image. So this is like typically like any other ultrasound scan basically, because the high frequency transducer, so it produces high resolution images, and of course the depth of penetration, I said, could be a limitation. There are a number of machines are now available. Useful like this machine is no more available now actually, but I think in our institution some of the best ultrasound images that we have captured were using this machine, but now it is not there. And as we will be discussing more, UVM is a very useful tool for studying anterior segment of the eye, especially in children, because a lot of pediatric glaucoma, you have angle anomalies, and cornea is not clear, and you don't actually you want to see what is happening behind the surface that you are seeing. And there, as Dr. Sushmita also remarked, UVM has actually is one investigation which has changed dramatically the understanding about the diseases, and we are actually getting now more and more insights into what's happening behind the surface. So the more is going to come in this in the instruction course, and you will see all the details in how we use this technology for the kids. Thank you very much, Sushmita, for bringing me here, and thank you everyone.
Thank you.